All right, so hello everybody and welcome. Before we get started, I'd like to acknowledge that we're meeting on Larrakia country today and pay my respects to elders past, present and emerging. I'll do a quick introduction for those who don't know me. My name is Tiana Ali and I'm working as one of the research assistants on the Communicate Study project. So we run monthly cultural safety, we are running sessions monthly for our Cultural Safety Champions group, and this group is a mix of doctors, nurses, and other allied healthcare professionals who are interested in improving cultural safety. And today we have also extended this invite to staff at Menzies. So thank you all for coming, and I hope you can take away something from today's presentation. Today we welcome Associate Professor Kelly Menzel. Kelly is a proud Ngadjuri woman from mid-north South Australia with connections to Bundjalung Nation in northern New South Wales. Kelly has a PhD in Indigenous Knowledges and has been an academic for over 20 years. She is the Associate Dean in Education at Gnibi College, Southern Cross University, Lismore. So welcome, Kelly, and thank you for being with us here today online.
Hey, thank you so much. Can everybody hear me?
Can you hear them? They said yes.
Oh, cool. I can't hear in the room and I can't see you at the moment because I need like 3 screens for all the stuff I've got going on. So I hope that you can see me okay because I can't see myself.
Yep, we can see you and we can see your presentation. So everything.
Excellent. That's a good start, isn't it? I appreciate it. Hey, thanks very much for inviting me. I really, really appreciate it. I'm coming to you from very, very cold Lismore, the lands of the Widjabul people of the wider Bundjalung Nation. So I would also like to acknowledge and pay respects to the Widjabul people of the wider Bundjalung Nation on whose land I live, work, play, and I meet you from today. And I recognise the significant role elders play in my life and the life of the region and the life of the university that I work at. And I'm mindful that within and without the buildings, the land always was and always will be Aboriginal land. And I'd also like to acknowledge and pay my respects to the people of the lands upon which you're all meeting me from today and all the Indigenous and non-Indigenous people in the room. So thanks very much for inviting me. Tiana briefly introduced me. I'm a proud Ngadjuri woman. I'm from the mid-north of South Australia. I am a registered nurse by trade, but now Associate Dean Education at Gnibi College of Indigenous Australian Peoples at Southern Cross University. I've been at the university for I think I'm coming up to my 2-year anniversary. Wow, that's gone really fast. And prior to that, I was at Bond University. And prior to that, I was at the Ngadjuri Institute at Deakin University. So I've bounced around universities a bit in Australia, and I also spent about 7 years in London working at a university in central London. And really working at that university is what brought me into the working with my own community in Australia. Prior to that, I was a community nurse. But when I worked in London, I spent a lot of time working with women who were from places like Africa, Central Asia, the subcontinent, and they taught me a great deal. And when I returned to Australia from London, I decided it was my time to give back to my community. So I moved into the Aboriginal Community Controlled Health Organisation sector. And I worked for the Aboriginal Health and Medical Research Council, and that changed everything for me. And I did my PhD and moved into Indigenous Knowledges. So that brought me to here. So that's just to give you a little bit about myself there. I've got my 2 countries there. Ngadjuri country is, I don't know if you people are aware of the Clare Valley. Lots of people are aware of the good wine that comes from that particular part of South Australia. That's where Ngadjuri country is. And Bundjalung country is in northern New South Wales, just crossing into Queensland. So 2 very beautiful parts of Australia is where my Aboriginal heritage is from. Today, I wanted to just discuss a little bit with you. I was very fortunate to work with a very good friend and colleague of mine, Associate Professor Richard Matthews. He works at Bond University, and I worked with him when I was at Bond. And we used to have some amazing conversations. He's a bioethicist and a philosopher, and so and has a Canadian man. So he identifies himself as a settler in Australia, and he worked with a lot of First Nations communities in Canada. And so we would have some amazing conversations. And one of our conversations, because I worked at Bond during the height of the COVID pandemic, was vaccine mandates. And we would have great discussions about, did compulsory vaccination mandates, were they effective in Aboriginal communities? And I've provided a little link there for, we published a paper in the Journal of the Bioethical Inquiry. So I can make this PowerPoint, I can give it to Tiana and she can send it out to you if you want to have a bit of a look at that. But we had this conversation and we decided it was worth unpacking vaccine mandates and cultural safety. Now, I probably would like to begin by prefacing, I don't necessarily believe in the concept of cultural safety. I don't think it's deep enough. I don't necessarily think any Aboriginal or Torres Strait Islander person is 100% safe in the health system just because of the nature of the health system, and that in fact, cultural responsiveness and cultural humility is probably a bit more of an appropriate language. However, cultural safety is pretty consistent language across the board. Cultural competency exists, all of that kind of stuff. I guess I don't want to get bogged down in the language. Rather, I'm a bit more interested in the concepts. And so we discussed, like, does that work in Indigenous communities? Vaccination in Indigenous communities is a fairly fraught space to begin with. What about mandating? So following COVID-19, making a case for mandatory vaccinations, very, very powerful. However, the main argument that we made in the paper was that cultural safety, cultural humility, and cultural responsiveness and the requirements for seeking consent from Indigenous peoples have to trump arguments about mandatory vaccination. And the consent of relevant First Peoples is and ought to be sought prior to any form of coercion. So that's basically the argument that we were putting forward, is that the imposition of coercion or mandates was actually violence being perpetrated by the settler state. I will unpack that a bit further in a minute. So Richard, being a bioethicist and philosopher, we spent a lot of time talking about when we acknowledge there are more than consequentialist and deontological arguments. It's not a binary argument, but for the purposes of the paper, and journals are restricted to a certain number of words, we had to sort of acknowledge that there are more arguments, but we would focus on the main two types of philosophical arguments, which is a deontological argument grapples with the challenges posed by the primacy accord, which is individual choice in deontological thinking. The primacy accord is the individual over everything, choice being the most important thing. And many of the deontological arguments explore the perspective of the obligation owed by citizens under conditions of an emergency. And from a consequentialist perspective is that consent is a basic norm of liberal societies and consequentialist considerations. So whether it's any utilitarian, social justice, feminist perspective, is that it's typically prioritizing the good of herd immunity and argue for coercive vaccination strategies when individual choices are consistent with public welfare. So basically, both deontological and consequentialist arguments converge, and that is that state-based justifications for coercive vaccination programs are appropriate. So in short, the claim is that refusals to vaccinate violates the rights of others not to be infected with communicable diseases. And from those particular philosophical standpoints is that we as citizens in a society have a relationship with each other and are thus reciprocal to one another when it comes to vaccination. And if we refuse to, then we're violating the rights of others around us, which is a nice argument to pose if you're talking about freedoms of everybody and equity. However, in reality, inequity is still an issue. Both arguments basically state that the justifications for non-consensual interventions, such as coercive vaccinations, forced vaccinations, those kind of things. And I also want to be clear, we kind of weren't talking about vaccinations of, compulsory vaccinations of healthcare staff and also those kind of things, because they're different arguments. We were literally just looking at marginalised communities and the imposition of a state over communities when there's already been a state imposition on those communities, such as Indigenous communities, and state control in those communities, which has a colonial history. We also didn't unpack misinformation around vaccine and that kind of vaccine hesitancy, because that is also another argument to be had too. So we were simply looking at the imposition of the state over marginalised communities. However, both deontological and consequentialist arguments state justifications for these interventions can be summarised as: there has to be grave threat to public health, the vaccine must be safe and effective, the use of the vaccine needs to have a positive comparability, comparative utility, and borrowing from just war theory. And that is about just war theory is about the safety of citizens. And the means of coercion have to be proportionate to the threat posed by the given vaccine preventable disease. And that is, there can be a variety of impositions imposed on communities, as we have seen over COVID-19. There can be lack of access to public spaces. Like with children and vaccine hesitant parents, kids aren't allowed to go to preschool and stuff like that. Or there can be things like imposed fines, prison sentences, those kind of things too. But that they must be proportionate to the threat. And that's going to be different every time there is a health threat. So in terms of coercion, as public health officials impose coercive measures, and the reason this is so important, particularly as I was coming from a nursing perspective and dependent upon your particular health profession, and Tiana said that there's, medical doctors and nurses in the room, is that we're part of this particular process because we're the ones either prescribing and or delivering these medications, is that these measures, we as public health officials need to pay careful attention to context to ensure that we do not inadvertently damage public trust and thereby undermine the effectiveness of vaccination campaigns, because there's already hesitancy in particular communities. And this is especially important as coercive campaigns are likely to provoke a backlash and result in negative responses both among practitioners and community members. And there was a lot of debate over the height of COVID-19 around this particular area when it even with practitioners as well as non-health community members. So that is what brought us to sort of think about inequality, inequity, and mandates and mandated vaccination. So both vaccine hesitancy and refusal are basically problems of trust, and coercive and non-dialogical measures can turn vaccine hesitancy into outright refusal. So basically, if you've already got a lack of trust and someone imposes something of you and takes away your choice, you're going to become more hesitant and flat out refuse whatever health measure it is. And if we go back to the philosophical arguments, so much of it is based around individual choice, yet mandates often take away individual choice. Thus, coercive measures risk alienating vaccine hesitant peoples and communities. In addition, stigmatization of those who are vaccine hesitant is also unhelpful and only serves to further marginalize people. Because what often happens in the public sphere is that when communities become hesitant and then refuse, public figures can further stigmatize, and that just further marginalizes groups of people, and they become more hesitant and refuse even more, and it becomes this standoff, thus creating more inequity and inequality. One of the problems with mandatory vaccination is that structural injustices, they shape all dealings with oppressed and marginalised populations, especially since the nature of mandatory vaccination programs are exercised in state domination of populations. Now, there's a lot of big words in there that I want to unpack, but basically, and I come obviously from an Indigenous perspective, is that so many state sanctions have been placed on Indigenous peoples. This is just another form of domination of Indigenous peoples in Australia, but also overseas, because it is about taking away of services and other things as a form of punishment, punitive punishment for not in this instance being vaccinated. So the problem in applying mandatory vaccination programs to Indigenous communities and individuals is that every action of a settler colonial state on a First Peoples is an exercise in structural injustice. So it is a form of settler colonial violence. It creates further harm to Indigenous peoples. And this is not the only way in terms of vaccinations, that health systems, and the health system is very, very closely intertwined with the justice system and with the carceral system around the world, because if you don't do something that is imposed upon you as a mandate, you can literally receive fines and or receive some form of punishment that enters someone into the justice system. That these two things are very closely intertwined. I don't know if anybody here is familiar with the lock hospitals that occurred in Australia right up until the sort of early 20th century. I can't see faces as to whether people are nodding or not, but the lock hospitals were hospitals in Australia that removed Indigenous peoples from country for, now it was meant to be for highly communicable diseases, STIs and things like that, but the lock hospitals were actually more like prisons. They removed people from country, some people who weren't even unwell, and many people never went home. They were held by the system away from their communities as a form of punishment for either being unwell, for having a highly communicable disease, and in many cases not even being unwell, simply just locked away. That happened in Australia, and that is the first instance in Australia where the health system and the carceral system interconnected. So that's just one example. So it's no surprise then that Indigenous peoples in Australia are reticent, as you would be aware, reticent to engage with the health system. So there will always be a level of lack of trust and a level of hesitation before engaging with. And then if the system comes at you with an imposition to place over you to further create hesitation, that's just adding to an already vexed situation. And so from an Indigenous perspective, we need to think about other ways of garnering support and getting a stake from community to engage, particularly with vaccinations, but with all parts of the health system. So another problem with mandatory vaccination is that structural injustices shape dealings with oppressed and marginalised populations, especially since by their nature, mandatory vaccination programs are an exercise in state domination of populations. And so in the case of applying mandatory vaccinations to Indigenous communities and individuals, is that every action, like I said, is an exercise in structural injustice. So every law, every resource allocation decision, and every policy is made against the background and backdrop assumption of the legitimacy of a settler state, whose existence is predicated on the violent subordination of alternate laws, economic practices, spiritualities, cultures, customs of the relevant First Peoples whose land the state has stolen, profited from, and now occupies. That exists every day that an Aboriginal or Torres Strait Islander person engages with any state system. That is the backdrop of engagement with the system. So this brings us to the concept of cultural safety, responsiveness, and a sustainable approach to how do we get people to engage. In this instance, I was talking about vaccination, but really cultural safety and responsiveness are key to engaging in any way with an Indigenous community, whether we're talking about health, whether we're talking about education, whether we're talking about the legal system, same rules apply. So it is about understanding that culture plays a significant role in how one perceives their health, how one interacts with the healthcare sector, and as such, health outcomes. So a different approach is required when addressing vaccine hesitancy in First Nations community. So cultural safety, responsiveness, and sustainability are necessary approaches to utilise when working with First Nations peoples and communities. And that is required at all levels. So a global, macro level, mid and micro levels of health promotion and public health program development and delivery. That needs to be coupled with a strengths-based approach. So a strengths-based approach is based on the premise that inherent strengths and resilience can be unlocked with structured support. So it recognises that individuals live within families, communities, and a culture, and that these have strengths and resources that contribute to well-being. And I think that that's really important, not only when we're thinking about Indigenous communities, but everyone. We all come from a family and a community and a culture, and there are things within that that are very important to us and that shape our worldview. And that, in fact, it's better to tap into that than it is to come from this deficit focus, which so much of the health system does. Like, I mean, all the rats and stats that we hear, they just make me depressed. Yes, we need to know them. We need to acknowledge them. They're a statement of fact. But actually coming from a place of strength, coming from a place of cultural humility, coming from a place of cultural competency and responsiveness as a practitioner is really important, and reminding ourselves that we aren't, as the practitioner, at the center of any interaction, that we need to be and utilize whatever language is appropriate to you here, patient-centered, client-centered, consumer-centered, the community-centered, is that the peoples that we're working with are at the center of this, not us. We're just a tool to facilitate whatever it is that they need. Even if we're talking about vaccination, whatever we're talking about is that we are meant to facilitate the process, not place ourselves at the center of it. I love a translation to practice slide. I use this every time I teach healthcare professionals, because all the words are great, but it's like, what do we do as practitioners to make a meaningful change, but also to engage with communities so that communities and people feel safe and want to come back? Because if you're culturally competent and aware and responsive, people are going to come back. And that's actually the best thing that could happen. If you get people coming back all the time, you're doing the right thing. And so practitioners and organisations need to undertake the fundamental ontological, epistemological and axiological shift. And that means transforming knowing, being and doing, and actively privilege and incorporate cultural safety and responsiveness principles into practice, policy processes and structures. So some of that stuff we can control and some of the stuff we can't. Us as individuals, it's really important for us to address, as an individual, our own bias and privilege. And this requires to what and I'm talking about in this particular paper, but I actually refer to this a lot with people that I work with, is the necessary work to be done by allies, accomplices, and/or co-conspirators at the cultural interface. And I love the language of co-conspirator. The language of allies, in terms of an ally, I actually don't love. I think allies, if you think about it in terms of war, allies have the option to withdraw at any time. And I feel like an ally then is not deep enough language. There's not enough skin in the game. An accomplice and/or co-conspirator stands beside someone, places their neck on the line along with someone that they're there to be with. And that's why I kind of like that language a little bit better. And in terms of the necessary work, I am talking, sorry, I just need to get up another slide. There's a couple of things that I think are, just to read to myself, things that I think are really, really important when it comes to the necessary work. And so one of them is that we must assume and confront racism and privilege, not only in ourselves, but it also means reflecting on and accepting one's own assigned and unearned privilege. And privilege is, we can't control where we're born into or the community that we're born into. We are born where we're born. What we can control is what we do with it. And so it is about accepting to become more understanding of how we impact others. We also always, when working with Indigenous peoples, must prioritise the voices of Indigenous peoples above our own. So First Nations voices matter, not those of other peoples and communities when we're talking about matters that impact First Nations communities. So one, skills and achievements do not take priority over the Indigenous communities and needs. Rather, we need to prioritise the creation of right relations. And right relations is an act of establishing relationships with First Nations peoples, and that is as an ally, accomplice, or co-conspirator. So it is about culturally appropriate, responsive, and reflexive mannerisms. So that is to listen to and believe First Nations peoples and adopt a position of cultural humility. So cultural humility is a commitment to self-awareness and reflection, and it also means redressing power imbalances and developing reciprocal non-paternalistic partnerships. And so powerful arguments for mandatory vaccinations or the state compelling a community to do something is not culturally safe, responsive, or humble, since the state presupposes the correctness of the approach and the correctness of imposing whatever it is the state wants and disregarding the objections of the Indigenous community upon which the measures are imposed. Also, too, in terms of being culturally humble, one must cede any right to determine, shape, or direct social, political, economic, or any agenda that involves Indigenous peoples. This needs to be determined by or in consultation with Indigenous peoples. We also have to publicly support Indigenous people's sovereignty, self-determination, and autonomy. And so that means acting only if Indigenous peoples judge it to be valuable. And if they say it's harmful, then us as practitioners, we've got to back off and remain silent. So also, if consistent with relevant Indigenous voices, teaching, not preaching, anti-racism messages to other privileged peers and peoples too. So it's important to involve peers in that process. When you can speak to other, colleagues about anti-racism principles, take the opportunity. Giving space to give each other, to express their views is really, really important too. And having really healthy conversations about that is important. I think that these conversations should be day-to-day conversations. It doesn't happen in a really day-to-day way. It should be kitchen table conversations. I invite you to have conversations with your family members, with colleagues. I don't care if you have them with your barista or your Tinder date. Like, I want you to be having these conversations all the time. This is how we address oppression in marginalized communities. It requires us to call out racism and cultural insensitivity when we witness it, which that can be challenging, and often we don't recognize it in that moment. It's not until we go away and reflect on those things that we see them and or pick up on them. So it is about learning from those processes, reflecting on those processes, and returning back to them too. Sorry, I just need to go back to my original slide so I can see it. So that's a lot I've put on you in a very short period of time. So I'm wondering if you've got any questions that you would like me to unpack about what I've said. I'll bring you back to the screen so I can see everyone. Yeah, now I can see people.
Did anybody in the room have anything to ask? Kelly, I actually had 2 questions I written down. So the first one is, how can you be, in simple steps, culturally responsive, besides what you've mentioned with addressing personal bias and privilege?
Yep. It's a really good question. And it's part of it, I think, is, and I haven't used the language of decolonization in this particular presentation, but I think it is decolonization and decolonizing ourselves. And we're all colonized, right? Like we're all grown up in, you know, this particular place and the systems that exist here. Is that how can we do that? And part of that is about acknowledging that you know, all of Australia is unceded, and so Aboriginal and Torres Strait Islander people are the first peoples of Australia, and there is no existing treaty anywhere at the moment in Australia. So acknowledging that, but also then activating one strategy, just one strategy to begin with, that can assist in decolonizing yourself. Whether that means, I don't know, going and doing a professional development on cultural responsiveness, having a conversation with your partner, you know, having these conversations at the dinner table with peers, with your children, about what is the history of Australia. So like a truth-telling process, the real history of Australia and the learnings from that. I also, and I do this with my students all the time, I throw this gauntlet down to my students, is if you're of a non-Indigenous background, even if you've had family who have existed in Australia since the First Fleet, and many, many people do, I really strongly encourage people to explore their own ancestral stories, find out what brought your family here, find out your history, find out the stories of your people, basically, and that will help place you in Australia differently. And I think that is a strengthening of individual identity. That is also something that I think is really important, because a lot of people, and I can speak to, my father's non-Indigenous, his family are of Czech ancestry, but many of his family members that were here since the First Fleet, is that they were disconnected from their Czech ancestry. So in understanding that and learning some of those stories and the stories of what brought family here, it has completely changed my father, my grandfather, their perspectives on Australia and their own reason for existing here as well. And so I would encourage people to do that too. Like, learn your family stories. It positions you differently here in Australia.
Yeah, definitely learning your own culture, of course.
Yeah, exactly.
Cool.
And I don't think that's encouraged a lot here. Like, you know, when you ask people what's Australian culture, a lot of people can't really answer that question very well. But without culture, what are we? So we need to understand that more, I think.
Did anybody online have any questions following on from that, or anyone in the room?
Please ask away. Happy to answer anything. I've got a lot of names on the screen, but I can't see anyone. So yeah, please do ask anything. Thank you for turning your camera on, Anna. I really appreciate that.
Yeah, no worries. I'm sorry I joined really late, so I don't feel like I've got any relevant questions to ask. But just following up on that last comment, it's, you know, how we have annual Harmony Day that kids participate in at school, and you show up wearing your national costume or whatever it might be and bring national food. When you're Australian, it's like, well, what on earth do you do? Like, other than harking back to your Scottish heritage or something. You know,
that's true, right? And I think it's really important is that we should know our stories of what brought family here. Many of us are multicultural, even in our own individual being. You know, we might have European heritage and, you know, lots of different types of heritages, and that we are the sum of our parts, and so therefore we should know those things, and it's okay to be proud of those things too. I think that will change everything for a lot of people, because identity and culture are really so tightly interwoven. And it seems weird to be talking about those things when we're talking about mandatory vaccinations, but they are absolutely interlinked, because we have to understand the concept of the colonial state and how that came into being. And so we need to humanize these conversations. We need to have these conversations on a daily basis. We also need to be able to respectfully disagree when we're coming from different places. And I think we don't necessarily have those skills readily available to us, especially the respectful disagreement. It's like, people, the things we're told not to talk about when we go into a party is like religion and politics. Why would you not want to talk about that stuff? They're the most interesting things to talk about, but we're told not to. I think if we become respectful and humble in those spaces, we can have those conversations.
Yeah, no, that's really great advice.
Any other questions? Is there anybody in the room, Tiana?
Yes, we have 6 people in the room, actually,
yay.
and we just got a question.
I was just wondering, do you have any tips on how to, I suppose, respectfully call out systemic racism when you witness it?
Yeah, such a good question.
Met with,
yeah.
Like very defensive.
Yeah, that's such a good question. And a lot of people see stuff happening and it's like, what do I do? And something you do in one situation might never work again. So there's no quick answer to what I can't give you a one fix answer to that. And I'm glad you're asking the question, because it happens all the time. And even like, I'll go back a bit. Like when a microaggression occurs, often you can be sitting next to the person who is having the microaggression perpetrated against them and miss it. And you're sitting next to them because it's not aimed at you. You don't feel it until you walk away and think, that happened and I was there. Sometimes that will happen, and we need to go away and reflect upon that, and that will help us develop those senses, to hone those senses, to become more acutely aware of those interactions. Sometimes we'll catch them and sometimes we won't. So I've been in situations where I've been delivering a conversation like this, or how to work with Aboriginal people to a group of practitioners. And I was in that particular setting once. It was a face-to-face setting, and it happened to be a white man who asked a question, and he objected to something that I had said. I don't know what it was, but he objected to it. And he had the microphone, and sometimes nothing worse than giving a white man a microphone. Anyway, he had it, and off he went. And the woman that was facilitating this particular session watched what was happening, recognized what he was saying was actually really quite racist, but didn't know what to do with it. I could see it across her face. And she could have gone and taken the microphone away, but like we're dictated by social protocols and stuff, and we don't want to be seen to be being rude, and so we don't do those things. She came up to me afterwards and she was so apologetic, and she said, I could see it happening and I didn't know what to do. And I thought, well, okay, that didn't help me in that instance, but this next conversation will. And so we had this really beautiful conversation around what are some strategies that could be done in the future? How do you navigate that when, we ask people to contribute, but then when they contribute, they're not contributing appropriately? How do you manage those situations? And so we had this really great conversation about that. There are also things like, you can only do something if you can remain safe in doing so. And if you're witnessing violence, sometimes if you intervene, the violence just gets redirected toward you, which is not safe. And so it is also about navigating those kind of situations too. But the bystander effect, and that's what it is when we don't interject, that can last up to 8 minutes. And 8 minutes is how long it took George Floyd to die. So we absolutely have to not be bystanders in that as well. but we can only comment if safe to do so. And that means asking respectfully inquiring questions like, that's a really interesting place to come from. What makes you think that, or what makes you say that? I think asking inquiring questions is actually a really good way to do that, because sometimes people, they run out of puff when you're asking them just an authentically inquiring question. They're like, oh, and then they recognize. I did it with a friend once. He was saying something outrageous one day about how he wouldn't rent a house to an Aboriginal person. And I thought, wow, you know who you're talking to, right? But I had these respectfully inquiring questions, and it took him about 3 or 4 questions that I asked him, and he went, oh, I'm being a little bit racist, aren't I? And I went, yes. And he came to that himself. I didn't come at him with, aggression or any of that sort of stuff. So I think it's about reading the room a little bit and then coming in with that inquiry as opposed to a challenge. Sometimes we can do it and sometimes we can't. So yeah, not always an easy question to answer, but a really, really good one.
Thank you for asking that question. And thank you for answering it, Kelly, as well.
Oh, that's okay. I'm hoping it was helpful. Like I said, what works once may never work again. That just shows how complex it can be. Yeah. And some people, you're never going to change their position. So it is also about like finding like-minded people in organizations and creating a safety bubble as well.
Mm-hmm. Are there any other questions? Would anyone online? Nope. Okay, well, I guess we'll wrap it up there. Thank you so much, Kelly. I really appreciate you coming and speaking with us, and your insights are really valuable.
That's my pleasure. Thank you so much for having me. And please let me know if you want me to send you the PowerPoint.
Yeah, we'll do.
All right. Thanks so much, everyone.
Bye.
Bye.